Hello, welcome to today's episode on Life Saving Aid. Today we are going to be looking at what to do for a victim of snake bite in order to help increase their chances at survival. Please, all snake bites should be treated as a medical emergency. The best thing you can do when it comes to snake bite is to prevent it from happening. And how do you prevent it from happening? It's important that you don't keep their source of food close to your home or at your home. For example, poultry. If you are keeping birds in your home, you are inviting, it's an open invitation to snakes. They will eventually find their way there. And this is why it's important that you keep poultry farm far away from the house. Ensure that your environment is clean. This way you prevent rodent, rats from having access to your home. And rats also attract snakes. That way you prevent snakes from coming around or hanging around your environment. Ensure that the place is well lit. Your environment is well lit. This is because you can be moving at night, or when you see a snake, you can avoid it. Snakes will not readily go after a human being. No, they usually avoid prey that are bigger than them. Another way to prevent snake bite is to ensure that before dipping your hand or your foot into any space, ensure you can see what is in that space. Take, for example, you want to put on your shoe in the morning. Don't just take a shoe and just put it on. No, take your shoe, look into it to be sure nothing is hiding inside. Next, if you work in an environment where you have a lot of snakes around, for example, you work in the farm, you work in a swampy environment, please and please put on the necessary protective gears. What do I mean? For example, you are working in a swampy environment or in the farm, you put on a boot, a rubber boot that gets to your knee. That way, even when there is a snake attack, the first point of contact is not your body directly. It is that rubber footwear, and it can help save a life. Now, in the unfortunate event of a snake bite, what do you do? Either as a victim or as the rescuer, you first of all move the victim away from where the snake bite happened. Now, in some instances, the snake might still be attached to the victim. So what do? You get a stick, okay, and you place it in between the mouth of the snake, because the mouth of the snake is open, attached to the victim. Okay, so what do? You put a stick in between, applying pressure, trying to move the snake away, something like this. Okay, please don't do it forcefully. The more you struggle with the snake, the more venom will be pumped into this victim. So very gently, you apply sustained pressure, pushing the snake away from the victim. Okay, once you do that, you quickly move the victim to safety. Now the victim has been moved to safety. What do? You call for help. Why you're trying to call for help, either you're calling your emergency medical services, or you're calling for or arranging for a means of transportation to the hospital, or you're calling someone that can get you to the hospital as soon as possible. What do? You must reassure the victim. How do you reassure the victim? Number one, you remind them that most snake bites are not venomous. However, we must get to the hospital in order to be sure that they are not venomous. Number two, when a snake bite occurs, the venom does not kill the victim immediately. So it means you still have time to do the right thing, get to the hospital, and you can be saved. Number three, the consequences of getting agitated. You remind them when you become agitated, your heart rate increases, your circulation is sped up, and this invariably increases the rate at which the venom spread around the body. We don't want this to happen. So we must continue to reassure. Please stay calm, help is on the way. Please stay calm, help is on the way. Some of the symptoms this victim can have include pain at the site where they were bitten by the snake. They can be bleeding from that site. You can see the skin color around the area changing. In some victims, the skin color around where the victim was bitten by the snake can be changing. In some situations, they might be having abnormal breathing. In some situations, they might be vomiting. In victims that are having vomiting, please do not lie them on their back. Transport them or lie them on their left side, with their mouth facing the ground. This way, you prevent choking from vomiting, and you increase their chances at survival. In the event whereby you notice the victim is not breathing, or the victim is not having a pulse, how will you know the victim is not having a pulse? You check for pulse, where at the junction between the lower part of the jaw and the neck, you check for pulse. No pulse. Please and please, at this point, the victim is in cardiac arrest, and you must continue to give CPR until help arrives or until you get to the hospital. And how do you give CPR in this victim? Chest compressions only, what we call hands only chest compression. You come to the middle of the chest, With your fist held this way, you apply pressure, you give chest compression, you are giving between 100 to 120 chest compression in every minute until you get to the hospital, until proper emergency medical services arrive. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33. You keep this cycle going until you are able to deliver 100 to 120 chest compression every minute, until either the victim recovers from that unresponsive state they went into, or until emergency medical services arrive, or until you get to the hospital. Please and please, it's important you also note that at the point where the victim was bitten by the snake, please remove any tight clothing around here. Do not use a rope to tie the place and say we don't want the venom, the poison to spread. You tying it, you worsen the situation of the victim. You worsen it. One, you are increasing the spread of the venom. Two, you are worsening the clinical state of that part of the body. So please do not tie it. Remove any tight clothing around the area the victim was bitten. If it's on the hand and the victim is having a ring, remove the ring, remove the wristwatch, let the place be free. And while you are waiting for means of transportation to the hospital, it is best either the victim is asked to lie on their side, on their left side, while you are waiting for means of transportation. And if the victim is well oriented in time, place, and person, the victim can sit down, but must be relaxed at all costs. It's important we know that there are some practices out there that over time, because they are traditional practices, people tend to feel, oh, this is the ultimate game changer. Whereas in reality, these practices worsen this condition of the victim. For example, making incision, that's you cut the part where the snake bit because you want the blood to come out, is a very dangerous practice. Please do not do so. Why? There are some snake venoms that one of the things they do is to cause the victim to keep bleeding without stopping. And in a situation whereby you've already made cuts in that part of the body, you see that you are helping the snake kill the victim faster. Because the victim, if it is that kind of venom, the victim will bleed from the places you made incisions. And so you worsen the condition of the victim. Please do not try to suck out the poison. In situations whereby people try to suck out the venom and end up infecting themselves with the venom. Please do not apply any herbal concoction. Don't allow anybody to start applying herbal concoction to that place. They might end up infecting the wound and making the condition worse. Please and please do not apply fire. Try to burn off the place and say that way it will kill the venom. No, it won't. You will end up complicating the condition of the victim. No matter the temptation to believe what they are telling you, we have a lot of snake bites that people died that could have been prevented. Why? Because they were trying to apply some traditional method, some traditional medicine. They sit at home, valuable time is spent, and then at the point where they are presented to the hospital, it's already too late. Lot of complications have set in, and you end up losing that victim. So please and please, as soon as you can, get to the hospital. So as a recap, what do you do when someone is bitten by a snake? Move them away from where the snake bite happened for help. Let the victim relax. This victim must not be agitated. Anything that causes agitation will worsen the condition of the victim. So the victim should be relaxed, either by lying on their left side with their mouth facing the ground, or by sitting in a comfortable place whereby the part they've been bitten by the snake, if it's their foot or their hand, is left in a resting position comfortably. That part of the body where the victim was bitten by the snake, remove any tight clothing from there. Please transport the patient with as little movement as possible until you get to the hospital. The treatment for snake bite is antivenom. Until the victim receives antivenom, and as soon as possible, the victim is at risk of the complications of envenomation. And envenomation is very dangerous. It can even cause death. I hope this information helps someone out there in an event whereby snake bite happen. We know the right thing to do, the things not to do, in order to help give the person a fighting chance at survival. Share this video so that together we can all save more lives. Stay safe out there.